Hi, if you who are someone who suffers from facial paralysis or synkinesis, then I'm pretty sure that you would have gotten advice to perform stretching exercises on the face. Well, stretching is great for facial muscles, but at some times this can go wrong as well. In this video, I'm going to explain you what is the right type of stretching that you should do on the face. At the same time, some important do's and don'ts that you should always keep in mind while doing facial stretching so that you can get best results on your exercises. Let's get started. Hello friends, I'm Physio Meghna Dave, founder and CEO of HealthQ Rehab, and I have 15 plus years of experience helping people suffering from facial paralysis, synkinesis, stroke, and the neuromuscular disorder that's related to head, neck, and face. If you are new to this channel, make sure to subscribe if you are someone who wants to learn more about tips, practices, and strategies to work on your facial rehabilitation. Let's get started with today's video. Friends, stretching is one of the very important or core practice that is part of a rehabilitation regime when it comes to physiotherapy or physical rehabilitation. Stretching ensures that the shortened muscle gets elongated. It improves the blood circulation, improves the flexibility of the muscle, at the same time helps individual attain good amount of mobility and functional independence. Stretching is not only limited to legs or hands, but can be done on facial muscles too. But when got wrong, it can lead to reversal or else worsening of symptoms than doing good. Hence, it's very important that whenever you are doing facial stretches, only do under supervision of a professional who understand facial rehabilitation well. So, let's first understand how stretching works. Your facial muscles have elasticity as a core property, which means, like an elastic, you can elongate a muscle, and once you release it, it can regain its original shape. But in certain conditions where there is a repeated contraction or unnecessary strain falling on the muscle, as a physiological response, the muscle gets shortened. These shortened muscles leads to limited mobility, restricted range of motion, at the same time pain as well. That's why stretching is a very important tool in order to get rid of all of these symptoms. When an individual suffers from facial paralysis, certain group of muscle gets tensed, especially in the acute stage or else in the early stage. The non-affected side of the facial muscles gets tensed because of overuse, whereas the eyelid muscle also gets tensed and tight. But as the condition progresses and if an individual develops synkinesis, at that time also the affected side of the muscle can get shortened, tensed, and thus require stretching. Now, stretching can be a great tool to reduce this spasticity and improve the length of the muscle. But it's very important for you to know when and how these stretching should be done. So let's first talk about how the stretching should be done. Few important things that you should keep in mind while stretching is the stretching should not be painful. Yes, you heard me right. If you are stretching a muscle and if it is hurting you, that's not a right stretching, or else you need to relax your facial muscles first and then you should start the stretching. Second thing, make your muscles warm enough before stretching. If your muscles are warm and then you stretch the muscles, the stretching would be much more comfortable and relaxed. Number 3, don't stretch the muscle which is already flaccid or else is not having any tone. The biggest mistake that I see patients while working on their facial muscles is that they stretch the muscles that are already flaccid or else as having very low tone. This stretching can further elongate a muscle which needs to be contracted, at the same time further drooping. People who are in the senior age group or its elders who have very limited collagen or less collagen on their skin, they might lose their elasticity and can get much more saggy skin due to the stretching. So these are some downfalls of doing stretching in the wrong way. So what is the right way of doing the stretching? Number 1, it's always good to do stretching exercises under supervision or guidance of an experienced therapist, because your therapist would be able to determine which muscles to stretch, which muscles to inhibit, and which muscles to activate. Not all muscles are fit for stretching exercises. Even though you are suffering from synkinesis, it's not necessary that all of the facial muscles needs to be stretched. Second thing you should keep in mind is always support one side of the muscle and then stretch the other side so that the stretching doesn't go more than required. The third thing to keep in mind is try to keep your stretching elongated, sustained, but at the same time not too much forceful that it limits the normal or physiological range. And last but not the least, select your muscles carefully and then only work on them. For example, if you have got tightness around the eyelids, then there are certain area from where only the stretching has to start. These areas are majorly the points from where the muscle originates. So stretching has to be done from origin to insertion and not from insertion to origin. That's why understanding of facial muscle is very crucial. Also remember, don't do icing on the face. In fact, on contrary, you would have heard that icing helps in making your face look more firm, tight, toned, etc. But if you're suffering from Bell's palsy or synkinesis, in these situations, that tightening might not help you, versus warm compression would be good enough. Third thing, stretching has to be done in a symmetrical manner, which means the aim is to attain symmetry of the face. That's why the pull quantity, for how long you will keep this pull, for how long you will cook, for how long you will maintain this pull, all of this will be determined by how tensed your facial muscles is. And last but not the least, after doing your stretching exercise, make sure you relax your facial muscles as much as possible. So the regime is first take a heat compression, then do the stretching, and then try to relax your facial muscles. Also, one pro tip I would like to give, never do stretching after facial exercises. In fact, first do facial massage, then do stretching, and then only do your exercises. That will be much more effective and beneficial than doing the vice versa or reverse. So these were some important tips that you should keep in mind while doing stretching exercises on your face. I hope this video was helpful for you. If you want further details related to your condition, the contact details are mentioned in the description box, on the card above, and the comment section. We hope to help you as much as we can. On that note, we'll end this video here, and I'll see you in another video. Thank you.